A technologist's daily routine involves a lot of bending backs, flexing arms and legs, pushing and pulling patients. Therefore, X-ray technologists are at higher risk of developing MSK injuries. One way to prevent these from happening is to practice proper body mechanics, and in this video, we are going to use stable principle as our example. The first letter of the stable acronym stands for keeping the back straight. Secondly, turn with your feet rather than twisting the torso. Next, it is important to keep the object being lifted close to the body. By maintaining a wide base of support, it will provide with the maximum stability while lifting. When lifting, bend at the knees and hips while keeping the back straight. Lastly, it is important to assess the surrounding, patient weight, and your own abilities. VHA provides an excellent flowchart to help in the decision making during a patient transfer, and it is based on patient weight and cooperation. According to the chart, patients who are partially dependent and weigh less than 120 pounds, a slider sheet can be used with one or two person assist. Patients who weigh between 120 and 180 pounds, either a lift/hover mat can be used or a slider sheet with two-person assist is needed. As for patients who are dependent or weigh more than 180 pounds, using a sling with the overhead lift or using a hover mat is required. This is scenario number 1. Mr. Bouchon is an inpatient who came down to the X-ray department for suspected bowel obstruction, and abdomen multiple views were requested. He was partially dependent and was able to follow instructions. Since he weighed between 120 and 180 pounds, a minimum of two-person assist and a slider board were needed for sliding him onto the X-ray table. Now let's see how stable principle can be applied when transferring patients. Okay, we're going to do a transfer from stretcher to X-ray table. The first step is to bring the stretcher close to the X-ray table, lower the rail bar down, and then put the brakes on. Okay, Mr. Bouchon, we're going to do a transfer from the stretcher onto our X-ray table. Okay, Mr. Bouchon, I'm raising the stretcher to my height. The stretcher needs to be adjusted to a height comfortable for the technologist. I'm lowering this rail bar down, and I need you to put your hands across your chest. Raise the X-ray table so that it is slightly lower than the stretcher. Sean, we're gonna roll you on your side towards us, and then Sarah will slide a board underneath you, and I'm rolling you back.
The proper method of transfer is to keep your back straight, bend at your knees, and use your legs to pull the patient.
Okay, Mr. Bouchon, on the count of 3, we're going to transfer you on this X-ray table. 1, 2, 3.
So we are going to show a transfer from wheelchair to the X-ray table. So this is my patient Koyel. She checked into the emergency department with an injury on her right leg. So the first step you want to do is lower the X-ray table, bring the wheelchair at a 45-degree angle with the X-ray table so that the patient's stronger side is closer to the table, which in our case is the left side. So next step is to get the footrest out of the way, which I already did, and then lock your wheelchair. Before transferring the patient, make sure you check the strength and stability of your patient. Koyel, can you please sit at the edge of the wheelchair for me? Can you now lift your left leg up in the air for 5 seconds? That's good. Put your leg down. Now, the patient is ready to be transferred. So in this scenario, I'm going to use this transfer belt to move the patient onto the X-ray table. Koyel, can you put this belt around your waist for me? So if your patient is able, then ask them to put the belt around their waist, or you can always help them. Thank you. Koyel, can you please put your both hands on the armrest and use them to lift yourself up during transfer?
The proper technique of transfer is to bend at the knees, keep your back straight, and grasp the transfer belt with both hands.
So on the count of 3, 1, 2, 3, lift, turn, and sit. Now you can remove your transfer belt. I can take it back. And I want you to lie on the table on your back, and I will help you